TUDCA is a bile acid and it might help with liver and gallbladder issues. It's also been researched for protecting the brain and improving eye health. Tauroursodeoxycholic acid, more commonly known as TUDCA, is a bile acid and it's found in trace amounts in the human body. Bile acids are compounds released from the gallbladder and they help to digest fat. Unlike UDCA, TUDCA is not an FDA-approved medication. The UDCA is approved for the treatment of patients with primary biliary cirrhosis, which is an autoimmune liver disorder. TUDCA is the same molecule, but it has taurine attached to it. Some evidence supports the use of TUDCA for diseases beyond the liver, though more research would be needed. Bear bile contains large amounts of TUDCA, and it's been used in traditional Chinese medicine for more than 3,000 years. However, TUDCA obtained from bears is extremely controversial due to animal welfare concerns. Bile is either extracted from live bears on farms, where the bears are kept alive in small cages and are subjected to either perpetually open wounds or to constant invasive surgeries, or wild bears are hunted for their gallbladders. These practices persist even though TUDCA can now be chemically synthesized. TUDCA and UDCA are nowadays almost always synthetically produced. Scientists are continuously developing new methods for environmentally and animal-friendly large-scale TUDCA and UDCA production, such as through fermentation of certain bacterial strains. Scientists propose TUDCA might act by increasing glucose-induced insulin release via the CAMP-PKA pathway, increasing insulin sensitivity. It might relieve endoplasmic reticulum stress. The endoplasmic reticulum makes sure that proteins are folded properly. It might reduce programmed cell death or apoptosis in healthy cells. TUDCA prevents the molecule BAX from reaching the mitochondria. BAX causes the mitochondria to release cytochrome C, which causes enzymes, capsases, to initiate the apoptosis. It may inactivate BCL2-associated death promoter, a molecule involved in apoptosis, and it might remove toxic bile acids from the liver and prevent them from damaging the liver cells. Cholestasis is a condition where bile doesn't flow properly from the liver to the gallbladder and then to the small intestine. Cholestasis is characterized by a lack of bile in the small intestine and an accumulation of bile in the liver. Cholestasis is often associated with other liver conditions, including primary biliary cirrhosis. TUDCA was able to reduce the cholestasis caused by liver injury from lack of blood flow. Alanine aminotransferase and aspartate aminotransferase, ALT and AST, are two important enzymes in the liver. Elevated levels of these enzymes can indicate liver problems like primary biliary cirrhosis. Primary biliary cirrhosis is an autoimmune disease that destroys the bile ducts, and it can also be caused by hepatitis. In one study done on 12 women with primary biliary cirrhosis over 2 months, TUDCA reduced the liver enzymes by 51%. In a study in 23 patients with primary biliary cirrhosis, TUDCA significantly improved liver enzyme levels, the ALT, the AST, the gamma-glutamate transferase, or the GGT, and the alkaline phosphatase. Some scientists hypothesize that TUDCA can decrease liver enzyme levels at low doses, though proper clinical data is lacking. A study of 5 liver disease patients found 10 to 13 milligrams of TUDCA daily for 3 months was able to reduce the liver enzyme alanine transaminase. Cirrhosis is a condition of the liver in which scar tissue replaces healthy cells. It's a common cause of death and illness, and it's currently the 14th leading cause of death in the world. A study found TUDCA was safe and effective in the treatment of liver cirrhosis in 18 patients with the disease. A study of 150 patients with hepatitis C found TUDCA was more effective than a placebo at progressively improving chronic hepatitis over a 6-month trial period. In one study, TUDCA reduced liver damage, oxidative stress, and scarring of tissue in mice with fatty liver disease. The effects of TUDCA on fatty liver disease in humans is still unknown. Scientists are also investigating the effects of TUDCA on hepatitis B and hepatitis D viruses in the cells. ALS, or Lou Gehrig's disease. ALS, FRS, is a functional rating scale for measuring the disability in the ALS patients, with higher scores indicating less disability. A study of 34 ALS patients showed taking 1 gram of TUDCA per day had higher scores after 1 year. The TUDCA was well tolerated, and there were no differences in adverse effects between the TUDCA and the placebo group. No evidence supports the use of TUDCA for diabetic complications. Copper levels are often elevated in diabetic patients. One study found TUDCA reduced high copper levels to normal in type 1 diabetic mice. Diabetic retinopathy is a complication of diabetes where the blood cells of the light-sensitive tissues in the eye are damaged, and scientists are exploring the effects of TUDCA on the human retinal cell exposed to high levels of sugar. Amyloid beta plaques are proteins that play a critical role in the development of Alzheimer's disease. TUDCA reduces amyloid beta plaque in the brain of mice with symptoms of Alzheimer's. It also prevented memory deficits in a mouse model of Alzheimer's. However, its effects on Alzheimer's symptoms and progression in humans remains unknown. TUDCA protected nerve cells in a mouse model of Parkinson's. It also reduced cell death in a rat model of Parkinson's disease. However, no clinical trials for TUDCA in Parkinson's disease patients have yet been completed. One randomized, placebo-controlled, double-blind clinical trial is currently recruiting patients to investigate the effects of UDCA on the progression of Parkinson's. Scientists believe the UDCA might rescue the function of the mitochondria and prevent C-Jun N-terminal kinase activation. The JNK pathway leads to the death of neurons in Parkinson's disease. The effects of TUDCA on Huntington's disease in humans are unknown. A study found that TUDCA protected nerve cells in a mouse model of Huntington's disease. It also reduced brain cell death in rats with the symptoms of Huntington's disease. A study in rats who were given TUDCA 1 hour after a stroke found that TUDCA raised bile acid levels in the brain, and scientists think this might be helpful for stroke recovery, though human studies are lacking. In another study, TUDCA decreased blood clot volume and cell death due to a stroke in animals. The TUDCA reduced both wound volume and cell death in the striatum, a part of the brain of the rats, by 50% after a stroke. TUDCA reduced heart cell death following a heart attack in rats. The study suggests the effects of TUDCA on heart function should be researched in both animals and humans. The effects of TUDCA on the eye and the retinal health in humans is unknown. Retinitis pigmentosa is a disease of the brain, a neurodegenerative condition, and it results in blindness. A study done on mice reported TUDCA improves the retinitis pigmentosa. The study noted that TUDCA preserved the rod and cone, the cells of the eyes responsible for vision. Leber congenital amaurosis is an eye disorder that damages the retina. TUDCA improved this condition in mice. Choroidal neolasation is the creation of new blood vessels in the choroid layer of the eye, which is a thin layer directly behind the retina, and it absorbs scattered light. It results in significant and permanent vision loss from the formation of scar tissue. In mice whose eyes were exposed to a laser to cause this condition, TUDCA prevented the CNV formation. The study suggests that TUDCA should be further researched for its effect on CNV-related retinal diseases. Based on existing evidence, TUDCA is likely ineffective for weight loss and obesity. In a study of 20 obese volunteers, 1,750 milligrams of TUDCA daily for 4 weeks increased insulin sensitivity by 30% in muscle and liver tissue. However, in the same study, there was no change in the sensitivity of fat tissue to insulin. No effects on blood glucose or insulin levels were seen, and TUDCA had no significant influence on body fat or weight. Despite the negative findings, bodybuilders are using TUDCA as a weight loss drug or a muscle building supplement. Diarrhea has been reported from doses of 1,000 to 1,500 milligrams of TUDCA. The following adverse effects were reported with the use of UDCA, which is similar to TUDCA: a worsening of pre-existing cirrhosis, other skin issues like rash, urticaria, dry skin, sweating, hair thinning, biliary pain, and cholecystitis. Digestive problems like constipation, stomatitis, and flatulence, headache, fatigue, mental health disturbances like anxiety, depression, and sleep disorder, arthralgia, myalgia, and back pain, and cough and rhinitis. A dose-response study of TUDCA tested doses of 500 milligrams, 1,000 milligrams, and 1,500 milligrams per day over 6 months, finding there was little difference between the doses on liver markers. 1,500 milligrams was the most effective at lowering enzyme levels, while 500 milligrams was the most cost-effective. One study suggested 60 milligrams per kg per day as a tolerable and administratable dose for humans. TUDCA can be taken at 10 to 13 milligrams per day for 3 months and is able to reduce liver enzyme levels. Scientists use 15 to 20 milligrams per kg body weight of TUDCA for improving bile salt composition. In otherwise healthy obese patients, a dose of 1,750 milligrams per day was tolerated for up to 4 weeks. In liver transplant patients, 500 milligrams of TUDCA taken daily for 1 year was not associated with any adverse effects. In patients with PBC, 750 milligrams of TUDCA daily for 2 months was well tolerated, and another study in patients with PBC found 1,500 milligrams of TUDCA per day for 6 months was also well tolerated. For more information on herbs, supplements, and natural treatment plans, check out my website.